Okay, it is 2 a.m. Your kid is burning up. You've been checking their temperature every 20 minutes. You're panic Googling fevers, and you're about 2 minutes away from just loading up and going to the ER just so you can have someone lay eyes on your child. Stop. Don't panic quite yet. I'm Jerry. I'm a pediatric RN and mom of 3, and I'm going to tell you what I do for my kids when they get a fever. You're probably going to want to save this because I'm going to give you a few different scenarios and talk about what to do at different ages. So in the heat of the moment, when you're panicking, you can come back and easily find this. And if you're not already, give me a follow for more tips about kids' health. So first, let's talk about the easiest scenario. Kids that are over 2 years old, 2 of mine are over 2, and this is what I would do for them. As long as the fever is not going above 105, or if it's close to 105, my kids tend to run really high. So if they're hanging out around 104.8, but the temperature comes down at least 1 degree with medication, I'm going to keep them at home for a few days. I'm going to, of course, give them extra cuddles and fluids and keep a close eye on them, but I'm okay with them staying home for 72 hours. If, again, fever is under 105, they're drinking fluids. They're probably sleeping more than usual, but they're waking up appropriately. They're probably playing a little bit, especially perking up when the medication is working. They're not vomiting. They don't have any other concerning respiratory symptoms. Overall, they're doing pretty good because it's not all about the number on the thermometer at this age. Now, let's talk about the most concerning scenario, and that is for infants that are under 3 months old or haven't had immunizations yet. If the temperature is above 100.4, do not give medications, do not pass go. You are going straight to the doctor's office or to the ER, depending on what they tell you to do or the time of day, but you're not taking any chances. You're getting them checked out. Even if they don't have a fever and they are not waking up, not drinking, continuously vomiting, have any concerning respiratory symptoms, whatever it is at that age, you're not taking any chances. I'm going to get them checked out, and I'd rather be the panicked mom and stay safe than anything else. Pretty much the same scenario for 3 to 6 months old, except I'm okay with a fever that's not going above 102. Under 102, if necessary, I'm going to give Tylenol. You cannot give Motrin for that age. Now, let's talk about a few more things for the older kids. Specifically, if they have a fever over 72 hours, like I mentioned, then I'm going to take them in, make sure there's not something that they need antibiotics for. If they have a fever for longer than 24 hours, but no other symptoms, then I'm going to take them in because I'm going to be worried about a UTI or ear infection, something that I can't see that needs antibiotics. Now, is it possible that they have a virus? Yes. And if we're talking about my kids, that's usually what it is. After another day, I'll see a rash pop up, and then I know that it was just a harmless virus. But if it is something that needs antibiotics, I would rather catch it sooner rather than later. So fever over 24 hours without any other symptoms, then I'm going to take them in. Biggest thing I want you to remember is that it's not just all about the number on the thermometer. It is more, I'm looking more at how are they acting? Are they drinking? What do they look like? Are they playing? Things like that. Look at the whole picture, not just panicking over the number on the thermometer. So remember, save this so you can find it when you need it. Give me a follow if you're not already. Share this with a friend who needs it. And remember that this is not medical advice. I am sharing what I do for my kids and hopefully giving you some real world guidance and help you feel a little bit more confident and less overwhelmed when that fever spikes at 2 a.m. But I don't know your child's specific situation. So if you're ever concerned, always follow your mom intuition and call your doctor.